welcome to the channel Nursing in Handy. So before proceeding into the topic, kindly like it, share it and subscribe the channel to have a latest updates in the channel. And this channel aids as a learning platform for the nursing fraternities to have a continuous learning in their profession. So today we'll be dealing about role of pediatric nurse. So who is a pediatric nurse? A nurse is a branch of science who deals with the pediatric populations, that is from the 0th day of the baby is born to the late adolescence, so till 18 years of age is considered as a pediatric nursing. So a pediatric nurse who mainly focus on this population of age group in order to improve their health status, and not only that, they improve their health status by assessing their growth and development. So growth, which is a measurable, it is a quantitative term. How we can measure is like in kgs, in units and all, we can measure the growth like height or weight. So what is the development? It is a maturation of the cells and also the development of their limbus, that is language development, intellectual development, moral development, psychosocial development and psychosexual development, emotional development and spiritual development, and also identifying the problems and needs of the pediatric population. And the same way, the pediatric nurse who also concentrate more on the preventive pediatrics, that is administration of vaccinations or any nutritional counselings or nutritional surveillance. So how the pediatric nurse will do the nutritional surveillance? By a ABCD method, that is assessing their anthropometric measurements, assessing their biochemical investigation, C for a clinical symptoms, and D for a dietary modifications. So if a baby is having a nutritional deficiency, as a pediatric nurses we have to provide a modified diet, so by assessing their 24 hours dietary recall. In this way, a pediatric nurse work and concentrate on the pediatric population to improve their health status and to accelerate their health status in a steady form. The role of pediatric nurse is constantly changing. These changes are as a result of expanding medical and nursing practice, emerging challenges in different aspects of childcare, consumer demand and technological advancement. Whereas the role of the nursing is considered as same, that is the ethical principle or any function, it is considered as same, but only the basic need will be differing, that is they concentrate on pediatric population. So definition: pediatric refers to the comprehensive and continued care of children. It serves both in wellness and illness. So as a pediatric nurses, we are in a position to concentrate on both the illness and also the improvement of the wellness. Next is pediatric nursing. Pediatric nursing is a branch of nursing concerned with the care of infant and children. It focuses on providing holistic care to infant and children. So holistic care is like a comprehensive nursing care from the neonatal period, that is from 0th day to 28 days is the neonatal period, to till the child reaches the adolescent, that is up to the 18 years of age, we provide a nursing care. So next we will be seeing about the goal of pediatric nurse. The fosters the growth and development, promote the optimum growth of physical, mental and social wellness. So as a pediatric nurses, we not only concentrate on the physiological status of the babies but also the mental and social status of the child, and also promote the healthy maturation as a physical, intellectual and emotional being with the context of family and communities. So if you consider about other aspects of nursing, we only concentrate on the beneficiaries, but here as a pediatric nurses we not only concentrate on children but also the families, that is caregivers and also the communities. Next, qualities of a pediatric nurse. So the pediatric nurse must possess some of these qualities are compassion, competency in their profession, courage to take immediate decisions and also problem solving skills, commitment to their service, respect to each and every individual of the patient or the caregivers and everything, sensitivity, empathy, that is putting themselves in other situation and thinking of their point of view, a good observant, responsible for each and every actions they are being providing, flexible, because even we are concentrating on the pediatric population, we have to be very flexible in taking all the decisions. Next is principles. The nurse should begin to build a working relationship with the parents and their children. The nurse must be aware that all the behaviors of child are meaningful. The nurse should accept the child and their parents exactly as they are. The nurse have empathy for parents and children. The nurse should let the parents and children know that their problems are important, and the nurse is there to aid in solution of those problems. So as a pediatric nurses, we must just make a harmonious working environment and also fulfill all the knowledge, that is each and every child and the family members have the right to get the information from the medical care personnel. So we are accountable in providing those information to the parents as well as the communities. And also the nurse must be willing to acknowledge the parents' right to take decisions concerning their children. And also the nurse allows the parents and children to express their emotions and even negative emotions. So whatever they are having the emotions, we have to make them to burst out. Whether they have positive emotions or negative emotions, we have to be keenly observing that. And the members of health team must make the parents feel they are comfortable, and we are the persons who are going to provide and improve the health status of the children. And also the nurse should ensure that whatever we are giving any education or any information to the parents, it should be in understandable language of the parents. For example, I know Tamil, so the patient knows only Hindi, means I have to make sure that any translator is available to teach or give the information to those family who have a language barrier. So we should not consider this language barrier in communicating or imparting knowledge to the populations or any like children's or caregivers. So we must ensure that their emotions and everything has to be ventilated out, and also the language barrier should be ruled out properly. So only we can provide whatever the knowledge, whatever the education. If we want any consent also, we can get from there. So once we build this only, they will have the trust towards the medical personnel. So next is role of a pediatric nurse in the hospital. In hospital, what are the care the pediatric nurse gives? So first is primary caregiver. So primary means what? The pediatric nurse should focus on the preventive, promotive, curative and rehabilitative care in all levels of health services. So in hospital, the care of sick children includes comfort, feeding. The feeding in the sense we are going to provide the weaning to the child, and also the breastfeeding, initiating the breastfeeding, bathing and safety. So at community setup, the basic responsibilities include health assessment, immunizations, primary health care and referral, etc. So these all the primary caregiver, that is a basic need has to be fulfilled by the pediatric nurse. Next is coordinator and collaborator. So coordinator and collaborator in the sense the nurse maintains a good interpersonal relationship and interpersonal communication with the child, family and other health team members. So as a pediatric nurse, we are not only the single person who are going to provide a improvement of the health status of the child, but also we are going to collaborate with other health team members like pharmacists, physicians or physiotherapist, a speech therapist. Like that, we are going to have a collaborative care and going to give comprehensive nursing care. Next is nurse advocate. So as a nurse advocate, we are going to safeguard the child's right to assist and to provide best care from the healthcare team. So we must ensure that whatever the care we are giving, it has to benefit the child and the family. And also for example, they are going for any surgery, means as a nurse advocate, we have to impart the knowledge to the parents regarding the importance of surgery, and after the surgery how the prognosis is going to be. So we as a nurses going to represent the patient, and also we are the bridging person between the physician and also the healthcare provider. So we act as a nurse advocate by imparting the knowledge. Next is health educator. So health educator, mainly we focus on the prevention of illness, promotion of health and maintenance, and prevention of further complications and disability. So mainly we focus on 4 C's, that is confidence, competence, communication, caring and empathy. So we focus on these 4 C's and we provide a health education. So health education is a very important tool in imparting the knowledge to the caregivers, because if they have so much of doubts regarding the prognosis, treatment modalities, we as a nurses has to clear out or rule out these all discrepancies. Next is nurse consultant. So we mainly focus on the guiding the parents about feeding practices, like feeding in the sense of weaning, when to start the weaning and how long we have to give the breastfeeding, and what are the methods of giving breastfeeding, what are the positions of giving breastfeeding, what are the foods has to be included in weaning, like that. Next is accident prevention. So since the children are in an age group of very excitement and where they are very explorative, so we have to make sure that the accident prevention is there, like foreign body aspirations or drowning, like that. Next is nurse counselor. So from the word itself it is very clear, we are going to give them counseling, and also we are going to give the time for the caregivers to take the decisions. So providing the guidance to parents in health hazards of children and health team for own decision making in different situations. So for example, I will be telling the caregivers like this surgery has to be carried out because in order to improve their health status. So for example, if a baby is born with cleft lip or palate, I have to ensure them that these surgeries has to be carried out. So this is the rule of 10 for the cleft lip and palate, like that we have to explain in detail. Next is case manager. A pediatric nurse should organize, monitor and evaluate the patient treatment for the successful outcome. So how the prognosis of the disease will be there after the treatment from the hospitalization. So mainly the nurse manager, mainly as a pediatric care units in hospital, clinics and community, they will do the problem solving abilities and also they will evaluate the patient treatment. So I have given some treatment, I have given any medication, how the outcome is there, whether it is a positive or negative, is there any improvement of health status is there or not. Next is very interesting is recreationist. That is, in ancient times and all, we can see that in a pediatric nursing there was no any play therapy in the treatment process. But now what happened, the nurses and physicians have thought that the play therapy is one of the very important aspect in improvement of the health status. So as a pediatric nurses, we are going to decrease their crisis imposed by illness and hospitalization. So they are going to get hospitalized. It is a very new environment, that too physicians and nurses are wearing the coat and stethoscope. It is very heartbreaking for them. They are going to be away from their own home. So in order to promote their health status, we as a nurse, pediatric nurses, going to act as a recreationist. Next is a social worker. So pediatric nurse participate in social services or refer the child and family to the child welfare agencies or necessary support. So sometimes what happens in nowadays, we are coming across like virtual autism and all, no, we are telling, no, like you have to not give any mobile phones to children in a very young age. So you have to impart the knowledge. If at all any disease has occurred, we have to refer them to the child welfare services. Next is nurse researcher. So as a pediatric nurses, we have to be the evidence-based nursing care. So whatever the nursing care we are going to give, we have to follow the scientific principles of each and every action we are going to do. So as a nurse researcher, since we as a pediatric nurses, we in our profession we have to do the research and rule out the evidence. Like for example, before I have said, like play therapy was not a part of the treatment in the ancient times, but now it is being added in the treatment process. So it is going to boost up the health status. So this is the evidence based nursing care. Next is role of pediatric nurse in community setup. So in the community area, what are the functions as a pediatric nurses they are going to give. So first one is community health nurse. So who is a community health nurse? A nurse who serves their job and who serves for the community populations. That is, they provide the services for antenatal mothers, postnatal mothers, under 5 children and geriatric populations and like that. In the same way as a community health nurses, and that too in the child health nursing, we are going to give the various we are going to improve the various health status like preventive measures, that is vaccination or immunization. Next is we are going to give the nutritional surveillance. So nutritional surveillance by assessing their health status, like assessing the health status like weight, height and anthropometric measurements, mid-arm circumferences, like that we will check and we'll come to know what deficiency the child is having or mother is having. So once you are boosted up the antenatal mother, they will deliver a very healthy baby. So we concentrate on the antenatal mothers, postnatal mothers and also the under 5 children. So mainly under 5 children, we concentrate on the vaccination, nutritional surveillance and prevention of nutrition deficiency in the under 5 children. So because they have increased morbidity and mortality rate. So only we are concentrating more often on under 5 children. And we are concentrating on the antenatal mothers. Why? Because we have to provide a therapeutic environment. So once the mother is healthy, she will rear a healthy delivery of the child. And in the same way, the postnatal mothers, so once they are healthy only, they will give a healthy breastfeeding techniques, and weaning, everything can be carried out. So we are going to, more or less, we are going to improve the health status of these all populations. Next is community school healthness. So nowadays in every schools we are recruiting the community school healthness. That means the school requires a nursing personnel who is going to give the immediate care to the adolescents or school age children. So for example, the minor injuries due to sports, or immunization, or basic health checkups, and basic health checkups, like we are going to assess their anthropometric measurements and tracking their growth and development. So previously in 3 months once they will do the anthropometric measurement from height to weight, like that. So first is primary level of prevention. So we as a pediatric nurses in the community setup, we work for the preventive measures. That is, first is primary level. Mainly we focus on the maintain the child's health status. We focus on the optimum health and growth and development of the children, and prevention of any diseases, and maintain the child health by antenatal care, institutional delivery, planned parenthood, immunization, nutritional counseling, health education, and hygiene. So planned parenthood only, like if they are planning for their pregnancy, means you have to give the prenatal vitamins, and institutional delivery, you have to encourage each and every mother regarding the institutional delivery. And nowadays we are seeing in even every populations are going to the primary health centers, government hospitals. So they are giving various benefits to the mother regarding their antenatal care, like nutrition kit they are providing, or economical support they are provided by the government organizations, and also health education. So health education regarding what all we can give to the in aspects of improving the child health is one is health education regarding the immunization, nutrition surveillance, prevention of diseases, or any like a promotion of health status, and improvement of play activities, and also checking their proper growth and development. Like the baby is born with 3 kg, so that 3 kg has to get doubled by 5 to 6 months of age, and it has to be tripled by 1 year of age, like that. So how the anterior fontanel has to get closed, and when does the fusion of the posterior fontanel has to take place, and what is the normal head circumference of the child, like that. We will be doing each and every aspect of the health status, that is health improvement of the pediatric population, that is from the 0-3, from the newborn we do. Why? Because once we do in a pre-early only, we can prevent the further complications in the children, and also we can make them, that is the adolescent, to enter into the healthy adulthood. Next is help the child to achieve optimal growth and development. So how you can achieve the optimal growth and development? Like periodically we have to check their growth and development, that is in 3 months once, 6 months once, how was their height and weight, and how was their head circumference, how was their chest circumference, hip circumference, like that we have to check it. And we have to maintain the road to health chart. So road to health chart means we will come to know, so every year twice we are going to check their anthropometric measurement, then individual family counseling, like menstrual hygiene counseling can be given. Then what and all can be given is like we have in a community setups and all, like weekly iron and folic acid supplementations can be given to the adolescent. And also for the adolescent girls, as a community health nurse, we can provide the sanitary napkins, and also we have to do the nutritional surveillance, like ABCD method. Next is prevention of disease. So once the disease occur, if we are giving any treatment, it is okay, but when as a pediatric nurses, we have to ensure always a prevention is better than cure. So you have to provide a preventive measures. So what and all we can give is like supplementation, nutrition supplementation, vaccination, and prenatal counseling, then promotion of the personal hygiene, and identify the symptoms of malnutrition. So what are the symptoms we have in malnutrition? So what are the malnutrition we have? We have protein energy malnutritions like kwashiorkor and marasmus, and even the micronutrients deficiency has to be carried out. So we should not only concentrate on the macronutrients but also the micronutrients. and we have to follow the recommended dietary allowance. So for each and every age group we have RDA, that is recommended dietary allowance. So based on that the nutrition status has to be improved. So how much kilocalorie has the child has to take, so when the weaning should start, and what all the vaccination has to be carried out, at birth what dosage is given, at 6, 10 and 14 weeks what dosage is given, and when does their weight get doubles, when does their weight get triples, like that each and everything has to be assessed. Next is secondary level. So in secondary level we'll mainly focus on the children and family for assessing their needs, planning for care, implementing the care. So we are planning the care and then implementing the care, evaluating the child's condition, providing health teaching to children and their parents. Next is tertiary level. So tertiary level is something like a disease has occurred, so some disability occur in that children, so you are going to bring back that disabled children to mere normal, so by providing some of the services like speech therapy, counseling, physiotherapy and health education. So I'll give you one simple example. Due to some unavoidable circumstance the child has end up with the amputation of the lower limb, so you cannot make them to be amputated and they cannot do their basic need by their amputated legs, right? So what as nurses we can do is we can refer them to have the prosthesis. So prosthesis, if they use it, means they can have a at least not a complete normal, maybe a mere normal level of activities can be carried out. So as a nurses we are going to give these referral services by giving health education and providing the counseling, like there are many children who has underwent amputation and now they are living their normal life, like that we can boost up their emotional status and psychological status by giving these counselings. And also speech therapy in certain conditions like stammering and stuttering, we can also give the speech therapies to the children. And next is rehabilitation. So rehabilitation is prompt referral the mentally subnormal child for rehabilitation. So now and all we are having like a child guidance clinic. So due to some behavioral problems, if a child is not in normal state, we can refer them to the child guidance clinic. Next is advise the mother about the importance of rehabilitation. So one maybe due to some unavoidable circumstances some instance has occurred, we have to educate the parents regarding the rehabilitation. There are some services you can make the child to live their life by fulfilling their basic need by mere normal techniques, like that. Next is arrangement of prosthesis. So I have said due to some situations if a child is end up with any amputation or we can provide them prosthesis and braces. So if they are having that prosthesis, they will think that okay, I am having my normal life, so they will not have that much worry about that. So you have to link by giving those referral services, contact numbers, everything. Next is counseling. So counseling is mainly based on the nutrition status. So nutrition we cover on weaning, nutritional surveillance, breastfeeding, everything. Next is contagious diseases. So prevention of any communicable disease. So once a child is occurring with any communicable disease, we have to isolate that child and prevent the child coming to the schools, like that. Next is malnutrition, family planning methods to the family members regarding how much years of differentiation of age should be there. Next is adolescence counseling regarding their menstrual hygiene and personal hygiene, everything. So far we have discussed about the pediatric nurse. A pediatric nurse who is very specialized in their profession by rearing the child age between the 0th day to the 18 years of age. We as a pediatric nurses should feel proud that we are going to handle the tiny tots, that is their first breath is being carried out by the pediatric nurse. So we as nurses should be very proud in giving their care, assessing their APGAR scoring to improve their health status, promoting their health status and initiating the breastfeeding. And this is a very a different experience for each and every pediatric nurses who handle the pediatric population with utmost care. So we as nurses has to provide play therapy, we act as a recreationist, we act as a nurse advocate, we act as a health educator and we act as a health counselor. So we play a multi-dimensional role and provide a basic nursing care. So we are very much empathetic and we even play with the children during the treatment process and everything. So that's all the topic. If you have any doubt, kindly drop down in the comment box and kindly like it, share it and subscribe it. Thank you for watching.